Hello everyone, hope you are doing well. Today we will see how can we write drunkenness certificate. When we write drunkenness certificate, when the alcohol intoxicated person brought by the police officer. This certificate written to the SHO means there is station house officer or the investigation officer, and for police station mentioned there and the reference number and date. This is general format for writing the drunkenness certificate. I will explain each step how can we write this certificate. Then the first step is address. SHO means the station house officer and the investigation officer mention it and write the address of police station. Then the reference number and date. Purpose, identify the police case, means how can we identify this is a case of normal or police by this. Then the patient information of the intoxicated person, name, son, daughter of wife or son जो भी हैं. Then the age, sex, weight and the address of that person. Purpose, to identify the person being examined, means which person examined by this information. Then the police detail, which police officer brought this man, brought by the police constable, name police constable का नाम, then batch number police station to record brought by the person. Then the fourth step is consent. For examination, consent is required in nearly all cases which are not legally. Then the consent for examination by that person, signature and thumb impression. Purpose, to confirm informed consent unless examination is legally mandated. Then the identification mark of that person, two permanent identification mark अगर उसके पास मोल है या फिर कोई भी identification mark है उसे लिखेंगे. Then the date and time of examination, जिस समय एग्जामिन कर रहे हैं और जिस डेट को कर रहे हैं उसे मेंशन करना है. Purpose, to ensure the correct identification. Then the sixth step is signs of alcohol intoxications. Then the person's behavior may be excited, talkative, aggressive, emotional or drowsy depending on the alcohol concentration. Speech may be slurred, thick, incoherent. That is also depend on the how much he or she consume alcohol. Then the smell of breath, characteristic smell of alcohol from expired air. Then the eyes may be congested, conjunctiva, dilated or sluggish pupil may be dilated or sluggish, and nystagmus means एक पॉइंट पे pupil नॉर्मल नहीं रहेगा, means they are movable. Then the face flushed or red face. Gait means how person walk. Staggering हो सकता है, and steady walking like ataxia means चक्कर खा के गिरने वाला हो या फिर not maintaining normal body posture. Stance, unable to stand steadily, swaying. Muscle coordination, there is poor coordination, difficulty in performing finger nose test. How can we perform finger nose test? That is the method to perform both side finger nose test. Then the reflexes, sluggish or delayed. Memory may be impaired. When it is also depend on the alcohol level, how much he or she consume alcohol. Self control, reduced inhibition, poor judgment, and the writing skills may be impaired. Then the other signs are pulse usually increase in the case tachycardia, then gradually it may be lead coma में अगर चला गया तो उसका कम हो जाएगा. Then the blood pressure may be normal or slightly decreased. Respiratory rate normal initially and depressed in the severe intoxication due to there is a coma type situation बन जाती है, इसलिए skin warm and flushed हो जाएगी. Cardiovascular system usually normal, S1 and S2 heart sound. These mention this आगे अपन देखेंगे. Then the seventh step is breath analyzer test. Breath analyzer test एक breath analyzer मशीन आती है, उसमें आदमी को बोलते हैं आप फूको, तो that analyzes the alcohol concentration. Expired air is testing using the breath analyzer. Purpose, estimate the alcohol concentration in the breath. Sample collection if required. If person telling कि I am not consume alcohol but the breath analyzer test is indicate that person is consume alcohol. Just like traffic police एक आदमी पकड़ती है, उससे ब्रीथ एनालाइजर टेस्ट कराती है, उसका कंसंट्रेशन मान लीजिए नॉर्मल से ज़्यादा आता है, परमिसिबल 30 mg पर 100 ml है, बट उसका कितना आ जाता है, उसका थोड़ा ज़्यादा आ जाता है। और पर्सन कहता है कि मैं एल्कोहल नहीं पिया हुआ हूँ, तो क्या करेंगे उसके लिए, सैंपल कलेक्शन इफ रिक्वायर्ड, देन द यूरिन सैंपल, ब्लड सैंपल, पर्पस लेबोरेटरी कंफर्मेशन ऑफ एल्कोहल लेवल, लैब में कंफर्म होगा। देन द ओपिनियन, मोस्ट इंपॉर्टेंट पार्ट ऑफ दिस होल ड्रंकनेस सर्टिफिकेट। फर्स्ट, द पर्सन हैज नॉट कंज्यूम एल्कोहल, अगर एल्कोहल कंसंट्रेशन 0 या फिर कुछ नॉर्मल रेंज तक आता है, जनरली 0 ही आता है अगर कोई पैथोलॉजी नहीं है तो। देन द पर्सन हैज कंज्यूम एल्कोहल एंड अंडर इट्स इन्फ्लुएंस, ये डिपेंड ऑन दैट सिम्टम्स साइंस विच आर बी डिस्कस इन द 6 पॉइंट। पर्सन हैज कंज्यूम एल्कोहल बट इज नॉट अंडर इट्स इन्फ्लुएंस, कम अमाउंट में पिया हुआ है। देन द पर्सन हैज कंज्यूम एल्कोहल एंड इंटॉक्सिकेटेड, ज़्यादा अमाउंट में। देन डॉक्टर ऑथेंटिकेशन, mention the date, time and the signature of that doctor, designation, official seal. This is the next means there is इसके आगे का था, when the person has consumed alcohol, then the breath analyzer test or blood alcohol has not consumed alcohol, then the blood alcohol concentration is 0 mg per 100 ml. If he has or she has consumed alcohol and it's under its influence, then the nearly 30 to 150 mg per 100 ml, 0.03 to 0.15% depending on the clinical signs. Permissible level 30 mg per 100 ml है ड्राइविंग के लिए। Has consumed alcohol but is not its influence, मीन्स उसने अल्कोहल ड्रिंक किया हुआ है बट उसके इन्फ्लुएंस में नहीं है, अगर उसका बिलो 30 mg per 100 ml है। Has consumed alcohol and is intoxicated more than 100 mg per 100 ml. Thank you.